Hi, my name's Todd Miner. I'm a licensed physical therapist and a certified canine rehabilitation practitioner. And this is RFIT Dog Therapy. And today is episode 3. We're going to talk about stretching and massage of the hips and back legs. So Earl is ready. We're going to heat him up a little bit and let's get to it. Okay, so we're going to start with using heat like we have talked about before in the first 2 episodes. Heat is a really good way to relax the body, to allow your massage and stretching to be even more comfortable for your dog. It's a vasodilator and it helps reduce pain and inflammation as well. You want to have it as high as possible, so if it doesn't burn you, it won't burn them. I'm going to stay up here, Earl. There you go. And then leave it on for about 10 or 15 minutes if you can before the massage. It's a good way to kind of cue them too that they're about to start their massage. All right, so let's imagine we've had this on for about 15 minutes and we're going to talk about the hips and the legs and stretching them out. So a big thing that happens with dogs as they get older is their back legs get weaker. Now, we're not really too sure exactly why this seems to happen, but it's consistent with all breeds. As dogs get older, their weight shifts forward, their backs start to hunch, and they get heavy on their front legs. Their head gets down, and they get light on their back legs. And their back legs, the muscles in the legs get smaller. So that's a big part of what we do at RFIT is we work on strengthening the back legs and getting their weight back on their back legs. My theory is that in many cases what happens is there's multiple little injuries over time that cause discomfort in the back legs, and so they have 3 other legs, they'll just shift off it. So what happens is dogs don't ever fully recover from some of these injuries, and over the lifespan they just stop using their back legs and they shift to their front. So that's just one theory. It's just something based on our own experience here. So what we're going to talk about today is providing comfort to the muscles in the back legs and the hips and checking their mobility. So this is a good way for you to kind of assess if there are issues, even if you may not see it. Or your dog may be a little bit light on their legs and you're wondering why, and this is a good way for you to kind of gently examine them to determine what's going on. All right, so let's talk about a little bit of anatomy in the legs first. Dogs bear weight on their metatarsals, okay, which is the pads of their feet. On a human being, this is the entire foot. We bear weight on the whole foot. So here's the heel and here's the forefoot. This would be where we would get plantar fasciitis, which many of us have. But dogs don't bear weight in this area. They just bear weight on here. So this is the primary joint for motion. And then this is the ankle. So the Achilles tendon is right here. This can be ruptured in dogs with play or from biting. We've had patients that have been bitten here and their Achilles tendon has been ruptured and had to be repaired. So we can rehab that. Moving up the leg, the next bend here is the knee. So you can see this is the knee joint. Very common in many dogs to get what are called ACL or CCL injuries. They'll have surgery. There's different procedures that can be done, but my opinion is that most of these injuries can be treated without surgery as long as we intervene soon enough and we can avoid the cost of surgery and the trauma of being put through surgery. All right, so here's above the knee is the quadricep muscle and the iliotibial band, and then we have the gluteal muscle. So by the tail and the leg, this is the butt right here. So this is the glute muscle that we're looking for. Here's the hamstring right here. All right, so those are all the muscles that we're working on. Normal hip motion. Here's the greater trochanter, which is a big bone that goes into the hip joint. So the femur is shaped like a little bit of an L, and this is the long bone. This part goes into the hip joint here. So when we look at hip range of motion, we take the leg and we bring it all the way back. Now Earl doesn't have any hip problems, which is nice, so he's a great example. What we're looking at is when you provide full hip extension, you should actually get spinal extension. It's almost like leaping over a fence. We should get extension here, you see? There's no discomfort for Earl. So many dogs come in, especially the older dogs, and they're only able to move to here, or maybe they'll get to here, but their back won't move at all. Normal motion is extension. We want to get nice extension. This is healthy mobility. Lacking mobility leads to osteoarthritis. Joints only feel better when they're moved throughout the range of motion. So as a dog, just like a person, as their motion is restricted, their chances of osteoarthritis and inflammation in the joint is increased. So mobility is very important for longevity. Okay, so just kind of a general idea. These are the areas that we're going to be massaging and stretching. Now, as we talked about before in the previous tutorials, I like to start towards the spine first, and we work distally. We want to open up the large muscles before we start trying to push fluid from the extremities into the body. So we talked about in the first episode massaging the low back, which was from the hip to the ribs. And we started with the technique of small circles. So now we're going to take that past the lumbar spine and we're going to go into the hips, and we're going to start with small circles. So it's the same technique that we used before, and you can work through all of this muscle tissue. And we can go into the hamstrings and then work back up. And all of this is very gentle again. You're looking for areas of tightness. You find an area that seems a little harder than other areas and you're sure it's not, the greater trochanter, which is right here, then you can linger on there and work. Okay? Into the quad muscle. And again, this is usually a pretty comfortable area. We're not having to manipulate our dog too much in order to get at these muscles. There's significant muscles underneath too, but we work up to that as your dog gets comfortable and allows you to move them. Some dogs don't want their legs moved because they're so sore. Then that's how you start. You let them lay and you just gently start working. So gentle circles. There you go. A second technique that we found that has been very pleasant and beneficial to these dogs is a deep stroking technique. So when I treated human beings, we'd get a lot of runners and we would work on their iliotibial band, which is this large V that runs basically from the hip all the way down to the joint line of the knee, the lateral joint line. What we would do is we would take our knuckles and we would rub very deeply all the way up. And humans hate this, but dogs, surprisingly, really like it. So we start stroking. Look at Early. Oh, he got a little reaction, didn't he? Oh yeah. And we work towards the heart. Just like that. From the knee all the way up the hip. Very good. And I'm putting a fair amount of force, but again, just like everything else we talked about, you start out very lightly and then you press harder as they tolerate. But this is a fairly deep technique. You see my knuckles are going right in. Okay? And this helps kind of loosen up the fascia around the iliotibial band and give them more mobility. Good job, Earl. Okay, so we talked about circles. We talked about deep strumming to these muscles. The next thing we're going to do is see if we can get inside the leg. Okay? So working our way up here, we're going to get into the adductors. So this is the groin from the knee right into the abdomen. And there's muscles here that run. Okay, now these muscles can get strained just like we talked about the latissimus in the upper body. If a dog's legs slip and go out, so the dogs are running and they're playing and they do kind of a Flintstone, skedaddle thing, they can strain their legs and we get lots of adductor strains. These are conditions we see here at ARFIT. And the best way to massage is going to be, again, small circles from the medial joint line of the knee up the leg, and you're going to feel rope-like muscles, okay? And you're going to work along those muscles and do circles. And all this should be very pleasant for your dog. You may notice when you're assessing your dog's motion, as we talked about with the hip extension, they may be very stiff moving this way in this plane. This is called abduction, almost like a frog position. If they're restricted in there, they could be inflamed or painful. It's also okay to put a heating pad under here before you do it. If you find out after your first time doing this that they're very tight in there, put a heating pad in there. Do that for 10 or 15 minutes first, and then work your way. Now you let them be and you work your way in. You don't grab their leg and lift up and go in. I'm doing that more for demonstration purposes. But you want them relaxed and comfortable, and if you have to start here and work like this, this is what you do. Okay? Very gentle motion. Okay, so again, what we've done is we've worked at the hip, we've now worked at the quad, we've done the lateral quad, and this is the medial quad or the adductors. We also did the hamstring. So now what I would do is I would talk about going from the toes up, just like we did in episode 2 with the front legs. We can work on gently stroking and massaging up towards the heart, just like that. Find an area of tenderness. You can stop and do light circles. Begin to loosen that up. This is when the curl falls. Now, if your dog may have a knee injury or they're recovering from knee surgery, there may be some swelling here at the knee joint. And again, you can use the same technique to gently work on the swelling, go back, absorbed into the lymphatic system. Something else to note is that you'll see that I didn't really do a lot of stretching of the knee. And in my experience, which I find very surprising, most dogs don't have knee mobility issues. It's very rare, even after surgery. Their knee mobility seems to never really become much of an issue. It's much more in the hip and the back that we tend to see. The other thing you should note is that unlike people, dogs' legs do not fully straighten. So you don't really want to stretch in this direction, okay? So this joint, the knee here, don't force it. Flexion should be pretty easy. They're very comfortable with bending their knees, obviously because they sit. All right. Work on all the tissue. After we do the massage again, if there was a restriction in their hip extension and they're comfortable, you can again, just like we did in the front, the technique's the same. We hold one hand by the foot, the other one above the knee, it was in the elbow in the other one, and we gently lift and stretch. And this can be a 2-minute hold to wherever they're comfortable. There you go. Good boy. And this is stretching all the tissue here, the hip flexors. This is where they tend to get very tight. Feels good on the back as well. Good boy. I'm not a big fan of doing bicycles and all this stuff that sometimes people are given for home exercises. I just don't like that complex manipulation. That it can be very uncomfortable for the dogs. It's much better to do gentle, sustained stretches like we just talked about, but not doing them cold. Warm them up and massage them first before you do any of that stuff. All right. So I think that about covers the hip and the hind legs. All right, well, that's the end of episode 3, massaging and stretching the hip and hind legs. I hope you got something out of it. If you're ever in Chicago, we're right in Lincoln Park. Come by and stop by. We've got our website down here. You can click on it if you want to schedule an appointment. And also you can click the subscribe button if you like the material that you got to see and you want to hear or see some more. All right, thank you so much for giving us your time, and peace.